own recording and with the built-in recording of our collab. Okay, so our topic for today will be the different types of sources. Okay, so the main bulk of pharmacy informatics is to search through various types of information. Now, depending on what information you will search for, you will look at different types of sources. Not all sources are the same, and not all sources will give you the information you will need. So today, I will differentiate the different types of sources together with some examples and how they might be used in practice, especially in our setting, which is we have access to the internet. So pharmacy has already changed together with the times. Most of us or most of the pharmacists are already connected with the internet. So, lagi nyo naman siguro dalang inyong phone. Pwede nyo siyang buksan pag may kailangan kayong i-look up. So, it is a new skill in which kailangan nyo matutunan so that in times na kailangan nyo mag-bring up ng information, mabilis nyo siyang makukuha. Lahat naman kayo may cellphone. Lahat naman kayo marunong mag-Google. So, this is just a application of that skill. Okay. So, we have three types of sources. We have primary, secondary, and tertiary. Okay. Primary sources are original materials on which other research is based on. It could be original written works, research published in scholarly or academic journals, or it could be conference proceedings, patents, dissertations, articles, reporting the results of clinical trials, and other publications of original research. So, ang kailangan nyo tandaan sa ating primary resources is this is the original source. Usually, these are research papers, thesis, dissertations, results of clinical trials. So, primary resources are, if we would describe primary sources, these are resources na mahaba, mahirap hanapin, mahaba, but they give the most amount of information. Plus, it also gives the nuance of the information, kung ano yung parameters ng study, ano information mo makuha mo doon, and how can you apply it to your practice. So, some examples of primary sources. Okay, so if you check my screen, I have the different tabs that you could use as a primary source. Ito mga to, these are not primary sources per se. Ito yung mga website na nag-host ng primary sources. Okay, so I have EBSCO. EBSCO is, I think, hindi ko alam kung funded by Lyceum. I mean, binabayaran ng Lyceum para sa kanyang access, but it serves as a search engine for research papers. And it also gives you access to various research papers on its database. Okay? However, EBSCO is multidisciplinary, meaning it does not limit itself to sciences. EBSCO also dabbles in arts and business practices and business research. For us, hindi siya masyadong nagagamit. EBSCO and EBSCO Science, hindi siya kasing ganda ng ating sunod ko ipapakita. Okay, next one. So this is ScienceDirect, ScienceDirect.com. ScienceDirect is one of the best places to find research papers. Particularly, you can find almost all scientific journals can be found here, except for those limited in other journals. So dito nyo makikita Nature, mga specialty journals like psychiatry, internal medicine, pharmacy, pharmacology, biochemistry. You can find the papers here. Okay. However, similar to EBSCO, kailangan nyo magbayad para ma-access yung content nito. Okay. However, in your research class and sometime in the future, I will teach you how to access this site with a backdoor. Pero in the future pa yan. Okay? So let's take a look. Ano makikita nyo? Para makita nyo rin kung ano ang laman ng isang primary source. Okay? So this one, Jatropha querca snail. Tingnan natin kung may lalabas. Okay. Last time, I actually assisted with a thesis. Wala. I actually assisted with a thesis with an engineering department in BSU. It was to eliminate snails from a rice field. So, I gave them my research. I mean, binigay ko sila yung copy ng paper na nakita ko regarding their poison and paano gamitin. Okay. So, look here. So, you have toxic effects of Jatropha querca in mice. Jatropha querca is your tuba-tuba. It is a locally available plant that is poisonous to both animals and humans. Okay. So, pag binuksan nyo siya, makikita nyo yung kanyang abstract. Okay. So, paano nyo malalaman kung primary source siya? Gantong itsura niya. May abstract siya. May findings. It is published in a certain journal. So, the journal name is Toxicology. Kung kailan siya pinublish, anong year, at anong page siya makikita. Okay. Okay. Ngayon, the problem with ScienceDirect is hindi siya hindi siya puno. I mean, hindi mo makikita yung buong journal hanggat hindi ka nagbabayad. Okay. So, in big universities like University of Santo Tomas and UP, Ateneo, and other schools, they actually pay the library and lists ScienceDirect as a service provider. Dito sa LPU, hindi nila kinuha yun kasi ang kanilang reasoning, meron naman silang EBSCO sucks. Wala siyang kwenta. Lalo na sa mga scientific journal na ating ginagamit, it is not applicable. Okay, so this is what a primary source looks like. It is very scientific in nature. Makikita nyo yung mismong data na ginagamit, ano yung kanilang findings, at ano yung kanilang recommendations. Another primary source of information is your clinical trials. Okay, so the US actually has a website for monitoring clinical trials in both currently conducting and concluded clinical trials. If you look here, you can pagkapindot mo dun sa kanyang mismo website, meron na siyang built-in search engine. Okay? So, ang ating bentang-benta ngayon is COVID-19. So, let's click here. Makikita nyo ngayon, lahat ng ongoing trials at saka lahat ng concluding trials sa COVID-19. Makikita nyo kung anong gamot ang ginamit, anong klaseng saan kinoconduct, anong condition ang tinitreat, anong title ng study, Okay? So, katulad nito. Pero hindi naman lahat ng clinical trials ay sa gamot. Minsan meron siya sa devices, katulad nito. Also in several procedures, tinetest din nila. Okay. Makikita nyo dito, pag kinlik nyo yung study title, you can see the full details of the study. Okay, makikita nyo kung anong status niya na. Siya ba ay nagre-recruit? Tapos na ba siya mag-recruit? Sinusulat din nila dito kung ano yung summary ng study. Anong gamot ang gagamitin? Anong phase? Okay, so the phases of clinical trials will be discussed in the future course. Ano yung study design? Paano nila gagawin? Sino ang blinded? Ano yung placebo? Or alin may positive control? Ito, arms and interventions, makikita niya. Also, ano yung outcome measures? And eligibility criteria. Sino ang pwedeng isali sa kanyang trial? Okay. Next. Sana. The next type of source is your secondary sources. Secondary sources are few and far between. They are primarily indexing services. So it will lead you to other primary sources and tertiary sources. So the main job of a secondary source is to give the title, then link you where you can find that title. Okay, so these are indexes of a textbook, points the reader to a specific information within the book. It could also include reference materials such as dictionaries and encyclopedias, books and articles that interpret, review, or synthesize original research. It could also be the internet search engine and online indexes created and maintained by abstracting or indexing services. A good example of this one is your PubMed. Okay. PubMed usually contains abstracts, but it does not contain the whole paper. When you compare it to... hindi ko pala share. Okay. PubMed, as compared to your ScienceDirect, does not contain the whole paper. Okay, let's have hydroxychloroquine. Kasi bentang hydroxychloroquine. Okay. Okay, so the main role of PubMed is to contain abstracts. You can filter the results on the left side. And you can simply click what interests you. Okay. Okay. So dito, makikita nyo ang abstract. Okay. It does not host the main paper, but it only gives you the abstracts and where to find it. So, merong link sa side kung saan mo siya mababasa ng buo kung kailangan mo siyang basahin ng buo. Okay. Dito ka magbabayad ngayon. Okay, so PubMed is like that. Indexing service lang siya. Does not contain the whole paper, but only contains the abstract. Okay. Next, we have our tertiary sources. So tertiary sources summarize or synthesize the research in secondary sources. Tertiary sources includes information that has been compiled and repackaged. Most of these are review articles, textbooks, and websites. So any book, any textbook you are using is actually a tertiary resource. Its information is based on previous researches. Yes, it is based on previous researches. Okay. Another type of source aside from textbooks, are websites, particularly news websites. Mga nakikita nyo sa Facebook, pagka-click ninyo, lagi nilang sasabihin, according to a study, bago pwede nyo i-click yung study, it will direct you to the primary source. And lastly is a review article. A review article is similar in appearance to a journal or primary source, but nakalagay ay review. See? Okay. So when we say review, it does not conduct a study. It only reviews already conducted studies. Kumbaga ay binasa niya na yung ibang papel para i-summarize niya. Yun ang role ng isang review paper. Okay. So yung mga authors, they collected different journals. They read the journals and summarized that information in a review article. So review articles are useful if you have limited amounts of time and kailangan mo lang makita kung ano ba talaga yung results. However, it does not give you insight on the different studies that were performed. Ano yung criteria na study, paano siya ginawa, and paano nag-conclude yung ibang studies. It only gives you the summary of results. Another example of a tertiary resource is your textbooks. So this is your Drugscom. Ang tanging librong mamahalin nyo in the next future. Sasama nyo pagtulog, sasama nyo sa paggala, sasama nyo sa pagkain. Itong Biblia ninyo in the next couple of years. Okay. So this is actually a textbook. Okay. This is a textbook, pero lahat ng kanyang information na sinusulat actually is based on researches or primary papers. Makikita nyo siya in the reference portion. Lahat ito ay studies. Okay? So if you wanted to review saan galing yung information na nasa textbooks, ito ang inyong titingnan, yung references. Okay? So, you might be wondering, bakit pa natin kailangan ng primary at secondary sources kung may textbooks naman, di ba? Okay, it is a matter of our field. Pharmacy and medicine in general is a very fast-moving field. The information you will find in the textbook is actually approximately 5 years old. So, pagtingin mo sa textbook na to, ay ganito. Mga bagong gamot. Yan, mga bagong gamot na yan eh. Pagtingin mo sa mga gamot na yan, the information presented there is actually 5 years old. Actually, Katzung and Trevor's updates or gives a new edition roughly every 3 years. Older books might not be up to date. Okay? Siguro, after lumabas ng bagong Katzung and Trevor's in the near future, ilalagay na nila dun sa anti-malarials, hydroxychloroquine was actually used in COVID-19. Ganon. Okay? So, the moment you open the book, it is actually already dated. However, we still use textbooks in our college. Wait. Baka ako'y nakamute. Di naman. Okay. So, we actually use our textbooks in college due to its very convenient nature. Lahat ng information nandyan na, you only need one book kung may kailangan kang i-look up. However, in current practice, what you want is either a primary journal or a review article. Okay? magsisimula ka sa libro, pero you might want to switch to primary sources if what you want is very specific. Okay, let's take a look at drugs.com. Okay, so sa drugs.com, ito yung best friend natin. Best friend ko rin to. Okay, so drugs.com is actually very useful because it gives the information both for regular patients and for pharmacists. Okay, so para gamitin to, search nyo lang yung gamot, makikita nyo. Ito makikita nyo sa unang page, yung overview. Ito pambata to. How should I take? How should I make those? Yung mga yan, alam nyo na yan. Pagka-graduate ninyo, alam nyo na yan. Hindi yan yung kailangan nyo tingnan. Titingnan nyo dito ay yung professional. Meron dito isang tab na professional. Pag-click nyo, dyan lalabas lahat ng kailangang information ng isang pharmacist or ng isang doctor. Okay, nandiyan yung pharmacology, yung iba't ibang metabolism, pharmacokinetic data, off-label uses. Okay, paano mag-dose, makikita niyo dyan. Okay, and lahat ng ito is actually based on research na. May sources din dapat siya sa ilalim. And most of the time, meron din siya iba't ibang ayun o, katulad dito, may FDA alert, nakikita nyo. Okay. So, kung wala sa drugs.com, drugs.com kasi is usually free. If you ask Ma'am Trisha or kung sino mang clinical pharmacist sa amin, if you look, ang ginagamit nila is not drugs.com but Lexicon. Lexicon is a paid service in which binabayaran nyo siya to give you the most updated drug information na vinevet or vineverify ng kanilang clinical team made out of doctors and pharmacists. So currently wala akong access because Lexicon is very expensive. Lexicon actually is magkano kaya? Ano kaya siya? Tingnan natin kung magkano siya. Yan. Ay, mura lang pala. It's not that expensive. Okay. So, 119 kapag essentials. Pag professional, 239. Pag premium, 700. Oh, $800 for 2 users. Okay, so yung mga ganito, ang nabili nito ay usually kung saan ka nagtatrabaho. If you work at big hospitals like Makati Med and St. Luke's, they will give you access to Lexicon. Maganda sa Lexicon, marami siya nagagawa. But I'll try kung saan ako makakakita ng saan ako makakahiram ng access sa Lexicon. Pero for now, it is a source na available to your company in the near future. Okay. Ngayon, how do you research properly? For example, a pharmacist who wants a background information on condition of patient should start with tertiary sources such as textbooks or websites. Okay, ganito, the more you know about a certain topic, the higher the level of information you should search for. Kung ikaw ay pharmacist at hindi mo alam kung ano yung sakit, you might want to opt for tertiary sources like a textbook para mabilis mong maintindihan. Pero kung critical cases like clinical interventions, you will move up to higher levels of information, particularly in clinical trials and best current evidence on efficacy of one drug over another. You could use Medline, PubMed, or Lexicon for that. Okay, so this would be the hierarchy of information sources. So tertiary sources here are usually the oldest. The oldest type of information, however, these are the fastest. What do I mean fastest? Yan pinakauna mo makikita usually. Because tertiary sources are relatively available. Secondary sources, on the other hand, gives you abstracts and will most likely lead you to primary sources and tertiary sources. Tertiary sources, primary sources, on the other hand, is the youngest type of source. It is the newest. And it will also give you the best information. Okay, it is, and particularly, you will need to take time to search for primary sources. Hindi siya kasing bilis hanapin, tulad ng isang textbook. Okay? So we have the bibliographic databases. It is an electronic index of literature that can include books, journals, and magazines like your PubMed. It is a secondary source. It provides better tools for focusing searches to find the most relevant studies while filtering out relevant results. Most bibliographical sources used in sciences are voluminous, that simple keyword searches yield many results. Okay? Example, ang sa PubMed. Okay. Katulad nito, pag nag-search ako ng hydroxychloroquine, it will give you results of 5,739. Okay, if you want to narrow your search, you should add more parameters. Coronavirus. It will now limit the search to 469. Okay, so that is how to limit your search, to how to best refine your search. So the challenge of good literature searching is to focus the search precisely on the topic without losing relevant information. Okay, so we have some terms to discuss. We have recall and we have precision. So recall is the ratio of relevant documents. So kung gaano kadami ang mai-feed sa iyo ng isang search engine. Precision, on the other hand, is anong type or how accurate or how relevant kung ano yung pinigay ni Google or ni search engine sa iyo, yun yung precision. Okay, so a search that retrieves every document related to the topic would have a 100% recall. However, the downside of this is not every document would be relevant. Okay, a search that retrieves no false positives would be 100% precise, but most likely miss many relevant documents. Okay, so you have to balance both recall and precision. You do not have to worry about this because search engines do this for you. Okay, they have these algorithms that actually narrows your search to give you the most relevant data first. Okay, so some guidelines for searching by bibliographic databases. Number 1 is to identify main concepts. Consider specific aspects of the topic and include terms to help focus the topic. If you want to search for diabetes mellitus, it will give you all topics related to diabetes mellitus. However, if you include another term, like a drug, it will narrow your search to only include the drug used in diabetes mellitus. Next is to define search terms. Think of as many terms as possible that describe the main concepts, including synonyms. If the database offers a controlled vocabulary, try to find a subject heading or descriptors appropriate to the topic and use those terms to focus on the search. Okay. Guideline number 3 is to use Boolean Logic. So what is Boolean Logic? You might be familiar with this if you have your Com1 classes back in high school. Boolean Logic uses 3 primary terms, and or not. Okay? So kapag sinabi nating and, it combines the 2 terms together. It actually widens the search. the AND operator will produce results that include all terms in the search. So acetaminophen and adverse effects. It actually limits the search. Acetaminophen and adverse effects, it will only give you results that contain acetaminophen and adverse effects. If it is acetaminophen alone, hindi siya ipapakita. And kapag adverse effects alone, hindi rin siya ipapakita. So it actually narrows your search. On the other hand, or widens the search. Pag sinabi niyong or, pag ginamit niyo acetaminophen or adverse effects, it will show you both acetaminophen and adverse effects. Pwedeng acetaminophen lang, pwedeng adverse effects lang, or pwedeng magkasama. So it will give you 3 sets of data: acetaminophen, adverse effects, acetaminophen side, adverse effects. So it gives you a very wide search. Okay, so ito naman, gagamit kayo ng not. So not limits or removes a part of the search. So acetaminophen and adverse effects, not overdose, it will give you acetaminophen and adverse effects. So it already limits acetaminophen and adverse effects, but it will remove overdose from the results. So, and pinagsasama, so you have already a limited search, then tatanggalin mo pa gamit ang not. Tatanggalin mo yung overdose. So, it will only give you acetaminophen, adverse effects, but does not include the overdose. Next, you can also use limits and qualifiers. Limits and qualifiers are used to focus the search. Okay. And guideline number 5, you can opt to use multiple sources. Use multiple databases to broaden the scope of the search. Okay, like I said earlier, our ScienceDirect is not the end-all. It is a good source, but it is not the only source. No one database is comprehensive. For example, in searching for information about the drug discovery, the Chemical Abstract Service database may produce a better result than the Medline database. Okay, let's have this. Okay, katulad nito. Pag naghanap ka dito ng hydroxychloroquine, ang makikita mo lang dito ay mga journals related to hydroxychloroquine. Hydroxychloroquine SLE, cardiomyopathy, pero pag mga ganito, medyo may hirapan ka. Hydroxychloroquine, molecular properties, gano'n. Okay, so you have to use a database that is designed for your use. Okay, as a pharmacist and a chemist in the future, one good source of molecular information is your drug bank. So this on the screen is your drugbank.ca. It includes drugs, targets, and pathways and indications. So if you search for chloroquine here, it will give you the various molecular information about hydroxychloroquine. Okay, pangalan, ano kanyang itsura, synonyms, itsura ng mismong gamot. So this is very professional type data. Most lay people will not understand this data. So mostly for pharmacists and doctors lang itong data na to. Okay, nandito yung kanyang pharmacology, pharmacodynamics, and different pharmacokinetic properties. You will learn how to use these properties in the near future. Okay, so yung katulad na sinasabi nung slide, not all information sources will give the same results. Okay, if you compare nyo from sa PubMed at dito sa drug bank. So you have to search on the proper website. Next is to use appropriate drug nomenclature. Choose the appropriate drug nomenclature in the source, in the search. In early stages, drugs may be designated by only their chemical abstract name. a manufacturer's investigational drug code, or possibly a generic name. Okay, a good example of this is brand names. Okay. Sa Pilipinas, uso ang generics. Pag may na-encounter kang gamot na hindi mo kilala, bago ang sinearch mo ay ang kanyang brand name, lalo na't generic siya, you might end up with a dead search. Okay? For example, medyo mahirap mag-isip ng Google. Mahirap mag-isip ng generic name. Atarbast. Okay. Okay, so if you search for the brand name, it will give you most likely the generic name as well. It is better to search for the generic name instead of the brand name. Okay? Ito, medyo branded pa to so madali nyo makikita. Pero pag yung mga nakikita nyo lang sa generics pharmacy at brand name ang search nyo, mahihirapan kayo maghanap. Promise. Okay, another one is yung mga codes na ginagamit ng manufacturer. Example, let's look at BioRender, no? Okay, so we have a COVID vaccine tracker here. Ooh. Okay, see, this is the importance of reading clinical trials. Okay, katulad nito, ma-off topic lang tayo. No clinical benefit was observed from the use of ritonavir at saka lopinavir. So what this means is these drugs would most likely be discontinued kasi walang clinical benefit so basically nagsasayang ka lang ng pera. Okay, so that is why we need to be updated with our clinical trials. Okay, katulad nito, let's look here. Sorry, yan. Okay, so we have different vaccines here. Nakikita nyo, some of these names are not intended for commercial use. Katulad ng IMM 101, AZD 1222. So these names are most likely their preliminary names before they are marketed to commercial use. Actually, lahat ng mga ito, clinical trials pa lang. Hindi pa yan ginagamit sa market. Okay. So, information about them might not be very available right now. Next guideline is to launch new searches from results. Once a list of relevant results has been obtained, look for links to launch new searches from those results and locate additional documents related to the topic. For example, authors listed in the references may be hyperlinked, so a click will invoke a new search on that author's name. Okay, so these are some examples of bibliographic databases for pharmacy and pharmaceutical sciences. Okay, so the next part of the lecture is how to search the World Wide Web. Marunong naman kayo na yan, mga millennial, mga Gen Z na kayo. Marunong na kayo mag-search ng Google. Okay, so this is actually an older part of the lecture. Okay, so when searching for the World Wide Web, if you use Google or Yahoo, it will actually give you a broad search result. And most likely, ang unang ibibigay niyan sa inyo ay Wikipedia. Okay, it's because we have two general parts of the web. We have the visible web, which consists of web pages and data that are accessible through a browser. And some web information is generated on the fly and intended for use by a single individual. So transient web pages are dynamically generated from the completion of a form. So this is your invisible web. So this is a good example of the division of the internet. What you actually see on search engines is the surface web. You have Yahoo, Google, Reddit, Bing, CNN. These are widely available information. But if you want some more specific information, like yung pinakita ko kanina, mga Lexicon, mga ScienceDirect, you will have to go deeper. Okay, so some academic databases, medical records, scientific reports, subscription-only information. This is not widely available. And finally, you have the dark web, in which you will find most of the illegal activities on the internet. Okay, so this once you can read at home. Sa akin na lang yan. And that would be the end of our lecture. Okay, so for our next meeting on Saturday, wala po tayong synchronous activity on Saturday. We would only have a activity. So magpo-post ako ng assignment also together with a quiz.